Hi everyone, this lesson is on the signs and symptoms of a urinary tract infection. If you want more information on how urinary tract infections are diagnosed and treated, please check out my full lesson on this topic. Let's first talk about what urinary tract infections are. They are most commonly bacterial infections of the urinary tract, and they are known as UTIs. And I say most commonly because we can see some fungal infections causing urinary tract infections as well. But for the most part, they're going to be bacterial in nature. So the urinary tract is noted here, and what is most commonly going to be affected in a simple urinary tract infection is an infection of the bladder, and we note this as cystitis. Now, there can be other parts of the urinary tract or urinary system that can be affected, including the ureters, and urinary tract infections can get so bad that they can ascend up the ureters and even infect the kidneys, causing pyelonephritis. We're going to talk about those complications in this lesson as well. Now, before we get into the signs and symptoms of a urinary tract infection, it's important to note that some organisms may colonize people's urinary tracts but cause no symptoms. So if they were to do a screen, they may actually see bacteria in their urine, but if they're not having any symptoms, we call this asymptomatic bacteriuria. Now, I mentioned this before, an ascending urinary tract infection, if it gets very severe, it can lead to an infection of the kidney, which we call pyelonephritis. Now, the epidemiology of urinary tract infections is as follows. Females outnumber males, and this is because females have a shorter urethra than males. So bacteria, how they get into the bladder and other parts of the urinary tract is that they climb the urethra. So because women have a shorter urethra, they don't have as much distance to travel to get to the bladder. So with regards to how many females outnumber males, it is a 4-to-1 ratio. And urinary tract infections are so common that it is estimated that 40 to 60% of women will develop a UTI at some point in their lives. In women who do develop urinary tract infections, they occur most often in women aged 16 to 35 years of age. And there are other risk factors that are involved with getting urinary tract infections. If you want more information on risk factors, please check out my full lesson on this topic. Now, having said all that, what are some of the actual signs and symptoms of a urinary tract infection? One of them is something we call dysuria. So dysuria is a sensation of pain described as a burning sensation while urinating. So as an individual is urinating, they have a burning sensation. We call this dysuria. And this is because there is irritation of the bladder and lower segments of the urinary tract caused by infective organisms. So there's inflammation, and there is this burning sensation when someone is urinating. So that is one of the symptoms of a UTI. Another one is urgency. So urinary urgency. This is the sensation of feeling like needing to urinate more quickly. So you feel like you have to very quickly get to the bathroom and urinate. And again, this is due to bladder irritation as well. Some other symptoms of a UTI include urinary frequency. So increased frequency of urination. So urinating more frequently than normal is a symptom of UTI. And this increased frequency of urination is due to irritation of the bladder as well. So that irritation makes the patient feel like they have to go to the washroom more often. And they often feel like they need to urinate even when the bladder is empty. So they'll go back to the washroom and try to urinate even when they don't have to. So those three symptoms we just mentioned, dysuria, urgency, and frequency, those are the three major cardinal symptoms of a UTI. Now, some other symptoms and signs of a UTI include the following. Foul smelling urine. So urine may smell more foul than usual, and this can be due to pyuria or pus in the urine, so white blood cells, and bacteriuria. So just the presence of bacteria in the urine can change the smell of the urine, making it more foul in nature. Another symptom of UTI that may occur is suprapubic pain. So suprapubic pain, pain in the pelvic area, or pain in the suprapubic area. This is due to irritation of the bladder. Again, we call this cystitis. Another sign of a UTI is what we call hematuria. Hematuria is blood in the urine. You can imagine that if there are bacteria in the bladder and the urinary tract, they can cause irritation and some trauma of the urinary tract, even at a microscopic level, causing some bleeding to occur. And this hematuria is most often microscopic hematuria, which means we don't see it with the naked eye. We can only see it on a urinalysis or a urine dipstick. And this is due to, again, organism irritation. Some other symptoms of UTI include urinary hesitation. So urinary hesitation is a difficulty initiating urination and or maintaining a urine stream. So difficulty starting and difficulty maintaining a urine stream. And we can also see something called post-void dribbling. Post-void dribbling is where there's some residual urine after voiding. So after voiding has completed, there can be some residual urine. Now the next signs and symptoms we're going to talk about are caused by pyelonephritis. Pyelonephritis is a complication of a UTI where that UTI has ascended up to lead to an infection of the kidneys. So those bacteria that have caused a UTI can travel up the ureters and infect the kidneys, causing pyelonephritis. So I want to mention that here because this can be a complication of a urinary tract infection. So in a pyelonephritis, we can see those symptoms we talked about before: dysuria, urgency, frequency, but we can see these other symptoms. Some of these include flank pain. So flank pain is where there is pain at the lower side of the back. So usually around in this area here at the bottom of the rib cage. And that is where your kidneys are located. So pain in the back toward one side at the bottom of the rib cage. And then if you were to pound on that area, the patient jumps due to pain from that area. That is what we call costovertebral angle, or CVA tenderness. So that is a very critical clinical sign of a pyelonephritis. And then because the kidney is infected, there can be fever and chills. So this occurs with flank pain and is actually one of the most common signs and symptoms of pyelonephritis. So along with flank pain, there can be fever and chills. And again, this is due to an infected kidney. You can imagine that if an organ is infected with bacteria, the body is going to mount a fever. Now, some other signs and symptoms of pyelonephritis include nausea and vomiting. So because the patient is very ill, their kidney is infected, they can have nausea and vomiting. This is a relatively common symptom of pyelonephritis. So if you want to learn more about urinary tract infections or pyelonephritis, please check out my lessons on those topics. And if you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and I hope to see you next time.